Hey guys, welcome back. It's been a while. I haven't had to make a breastfeeding video in a long time since Bentley weaned back in February, but I will be making more in the next couple of months. We are expecting our third, and I am due April 5th. So we're having another little boy, we found out. So now we'll have 3 little boys, and I'm so excited. I wanted to show you guys a quick video of how to give a progesterone injection. Both of my babies were born early at 32 weeks and almost 35 weeks due to preterm labor. And we're not sure what causes it, but one of the medications that is often given to expectant moms is progesterone injections. They say that it helps prevent uterine contractions, and it can sometimes help the moms go to full term. I've read a lot of case studies and talked to a lot of moms who use it, and I've had mixed reactions. Some moms have gone to term, others actually went shorter than they did when they had their first preemie. So it's not something I think is going to make or break this pregnancy and get me to term. With Bentley, I was on it, and I only got 2.5 weeks, a little less than 2.5 weeks further with him. However, it's one of those things that, see how big he is now? It's one of those things that it won't hurt me. There's no side effects. It won't harm me or the baby. And if there's a chance it could help me, then I'm going to definitely do it. If there's a chance it could get me to term, I'm definitely going to do it. Now, because I'm a nurse, I give my injections at home. It's every week starting at 16 weeks. And it goes until about 35 weeks, 36 weeks, something like that. It depends on what your doctor wants to do, how long they want you to go. Mine says 35 weeks. So I started it about 14 weeks ago. I'm exactly 19 weeks today. So every Thursday I enter a new week, and that's when I give my injections. So like I said, I get my medication delivered to my house so that I don't have to go to the doctor every week and get the nurses there to do it. Because I'm a nurse, so why not give it to myself? So the Makena comes in a little vial like this, and the dose is just 1 ml, 1 milliliter. They also send me the syringes and needles that I need. So basically you have to draw it up in a syringe with a large needle. This is an 18 gauge needle, so it's a pretty big needle. But then you deliver it in a 21 gauge needle, which is a little bit smaller. So it doesn't hurt so much. And basically, so every week I set everything out like this. I've got my alcohol pads. You want to clean the site and clean the top of your Makena bottle. You can have a cotton ball or some gauze around, or a Band-Aid too if you're prone to bleeding. I usually don't put that on. I don't like Band-Aids anyway. They stick and I think they're a pain. So I hardly ever use Band-Aids. If anything, I might just hold the alcohol swab there after I'm done taking the needle out, just to put pressure and hopefully stop it from bleeding everywhere. But I usually don't have problems with bleeding. And then this year, this pregnancy, I got something fun. I got a Sharps container. This time, with Bentley, they didn't send me a Sharps container, so I just used an empty bleach bottle. And you can use that too. Bleach bottles are great, empty milk jug, something hard, plastic, that the needle won't pierce through if you don't get a Sharps container. Now, like I said, it's a weekly IM injection, meaning intramuscular, so you have to give this into a deep, really thick, good muscle. And the preferred site for progesterone is in your butt. So I'll kind of show you here. What you want to do to find your site for the progesterone is you want to mark your cheek into like 4 quadrants, basically. So in half this way, and then in half this way. And then you want to do the upper outer quadrant, so right about here. And you just, I'm not going to show you my butt, but you just take the needle and it goes right in. And squeezing your medication. I usually push it kind of slow because it does hurt, and it's an oily medication, so it's pretty thick. So it is kind of hard to go in sometimes. But I usually push it pretty slow, and that tends to help a lot. There aren't any side effects. Now, I've already washed my hands, so I'm going to go ahead and draw up the medication and show you as much as I feel comfortable showing you the process. So I'm going to take the lid off. And I'm going to clean the top of my Makena bottle with the alcohol pad and just leave that there. Now I've opened this, and here's my syringe with my 18 gauge needle on it. And this is what I'm going to use to draw up the Makena. Now what I like to do before I draw it up, I go ahead and clean my site. I find it and I mark it and I clean it. That way it's dry by the time I'm ready to inject. So let's go ahead and I'm gonna find it and just rub it really well. A trick I like to use when I'm at home, I make sure I rub it really hard with the alcohol pad to make kind of a red area, and that's my marker so that I know where to go. And the bigger you get, the harder it gets to see your butt. So it helps if you do this in front of a mirror, which I'm gonna do. And so if you rub your butt really hard where you're gonna inject, then you can look and say, oh, there's the red area, that's where I need to go with the needle. So I'm gonna stand up and do this in the mirror and try not to get you guys in the shot. Here, I'll go over here. There we go. Okay, so while that's clean or air drying, I've got my Makena, and again, I've swabbed it with alcohol. Okay, so you've got your needle. Just pull the end off. Put it straight into your bottle. And pull back on the syringe. Do you see the medicine drawing up in there? And this is a 1-dose vial, which means there's 1 ml in here. So hit it on the countertop to get out any air bubbles, and then just squeeze until you get to the 1 ml mark. And as you can see, there we're at the 1 ml mark. Now at this point, don't forget to take your 18 gauge needle off. You never want to recap a needle, but if you haven't injected it yet, this is really, the best way to get the needle off. Put this in the sharps box. Okay, and now we're going to put the 21 gauge needle on. The first time I gave this a couple weeks ago, I almost forgot to switch from my 18 gauge to my 20 gauge needle, and that wouldn't have been good. Or 21 gauge needle. So here's the 21. All right, we're gonna go straight in and then inject the medication and come straight out. Now I'm just gonna do this over here in the mirror. 1, 2, 3. Now, when I started nursing school about 11 or 12 years ago, we were always taught that once you inject the syringe, you pull back, you aspirate to make sure you're not in a vein. That's no longer really the practice anymore. So you'll see some old school nurses maybe still doing that. They might pull in and then push back to see if there's any blood to make sure they're not in a vein. We don't really do that anymore. Now, this is what I just injected, so I'm going to put this right in the sharps box. Especially with Bentley over here playing with everything. Did you guys just see my butt, I think, by accident? Oh, well. Anyways, I'm holding the alcohol pad to where I injected, but it's not bleeding, so it's fine. So I'm going to get dressed over here real quick. Okay. All right, and so that's it. Now, this is a glass bottle, so I'm going to throw this away in the sharps container too, because if you put it in the trash can, it could break into little pieces, and you don't want all that. So I'm going to put this in here, and that's it. That's it for this week's dose, and I'll continue to do that weekly until either I go into labor or I hit 35 weeks, whichever comes first. With him, he was born at 34 and 6 in the late afternoon on a Tuesday, so I was due to give my injection on Wednesday, the next day, but he came early, so I didn't quite make it to 35 weeks with him, so we'll see how far I make it this time. You guys, please keep me in your prayers and pray for this little baby boy that he, at 42 weeks, I'm walking around really big and uncomfortable, and I have to be induced. That's my prayer. I want to get big, and I really want to feel uncomfortable this time. I would love to go to term and you know, have my baby and actually be able to bring him home with me from the hospital. That's been the hardest part about having preemies. So anyways, all right, that's it. Thanks for watching. Leave me a question below if you have anything to ask me, And I will be back to do some breastfeeding update videos here in the next couple of months, hopefully by next spring. All right, bye guys.